Thank you, Dr. Hamid. So what a beautiful segue from hope and good news. My topic for today is survivorship. And as I just load the presentation, sorry, that's okay, I got it. So what this topic of hope and good news that all of our colleagues have provided today is the transition to discussing survivorship in melanoma, and what does that look like? So the terrain for treatment has changed for melanoma, which indicates that survivorship changes as well. So if we look at various definitions of survivorship, we actually have the opportunity to redefine what survivorship means. Does it mean that we've completed surgery, or we've completed adjuvant or neoadjuvant therapies? Are we in the midst of a year-long immunotherapy intervention? So where does survivorship start? Where does it stop? Is it ongoing if there's a recurrence? And it may be unclear right now how to define survivorship. And because some of our patients may follow a treatment throughout their lives. So our patients might have a desire to get on with their lives, but they may remain in treatment through the course of their life. So unfortunately, we can't see my presentation. I'm not exactly sure why, but the next question is, what is health? So health has been defined by the World Health Organization since 1948. By the same definition, there have been no changes. So health is a state of complete physical, mental, and social well-being. And it's not merely the absence of disease or infirmity.
Sorry, hold on one second.
So if we think about that, that really brings into the conversation what Dr. Davies was saying and what we've been discussing, that there is actually a whole person component to treatment, to survivorship. So it's not merely, do we have any evidence of disease, but rather, what is our functional status? What is our physical status? What does our quality of life look like? And how are we finding enjoyment, meaning, purpose in our life? So if that is what's in our minds, we're thinking about how do we define survivorship? How do we define health? Thanks. That leads us to have a long list of survivorship considerations. So those considerations, as I mentioned, can include quality of life, physical functional status, intimacy, relationship, role changes within our relationship. So if we have a different functional status, then our role within our relationship might change. We might have been the provider, the caregiver, but now we're the patient. So we might have been the breadwinner, but now we're no longer able to play that role. We might have always been the one who drove places, but now our partner has to drive. So thinking about the impact on finances, employment, role changes, our psychology. So there's impact on mood, on coping, and on spirituality and faith. Has our spirituality and faith been taken into question? Or is it something that's feeding us and supporting us and strengthening us as we go through our journey with melanoma? But one thing we know is true is that we are resilient as human beings. So resilient is defined as able to withstand or recover quickly from difficult conditions. So none of us anticipate that our lives will be interrupted by a cancer diagnosis. And for some people, that's like running into a brick wall. And when that happens, some people are able to create new pathways around the wall, and some people leap over the wall. and some people stay at the wall for some time. But what we do know is that resilience is coupled with better outcomes as we go through the treatment cycle. So one of the pathways that we talk about developing resiliency to becoming more resilient is through mindfulness. And many people, when they think of mindfulness, might think of an individual sitting cross-legged in the Om position, meditating. But mindfulness is so much more than that. It's actually paying attention to the present moment in a particular way. It's without judgment, on purpose. And that non-judgment is incredibly important when we're in the midst of treatment, when we're thinking about what does life look like post-treatment. How are we different? Do we look different, act different, relate differently with our peers and our families, our friends? So the purpose of mindfulness is really to develop the present moment awareness, to get to know our bodies, the sensations in our body, and to reconnect with our body as an ally when we might have felt betrayed by our body's cancer diagnosis. To decrease the stress response at a physiological level in our bodies, to strengthen our emotional responsiveness versus reactivity. And this is a really important point, because when we're stress reactive, what that means is that somebody cuts us off on the freeway, we immediately have a hand gesture, a thought. But if we're able in that moment to be responsive, to choose to say, oh, that person must be in a hurry, that changes our stress response in our nervous system. It changes the stress hormones coursing through our bodies. And that changes our physical status, our mental status, and allows us to improve attentional skills. So mindfulness is not necessarily about becoming relaxed, but it's about developing focus so that we can determine what is really driving our body, our thoughts, and our emotions. So the benefits of life enhancement and extension are one of the things that we see with mindfulness. It can change the structure and the function of the brain, the pathways in the brain, and improve physical health measures such as insulin, inflammation, energy, metabolism, and pain. And if you've ever been in pain, you can notice that there's a relationship between when we're anxious and how much pain we have. It's a bidirectional relationship. So if we're in pain, we might be more anxious. If we're anxious, we might have more pain. And so learning to recognize what's happening, is it the pain or the anxiety driving what's going on in our bodies? So by developing this triangle of awareness, by noticing our thoughts, our emotions, and our body sensations, what this does is it gives us the space to determine a response. There's a famous quote by Viktor Frankl, who wrote a book called Man's Search for Meaning, which talks to purpose and meaning. But the quote is, between the stimulus and response is the space. And in that space, we can choose our response. So we're no longer at effect of what it is we're being diagnosed with, treated with, or facing in our lives. So we start to recognize a body sensation as a trigger for, I'm feeling anxious, I'm feeling depressed, I'm feeling overwhelmed, I'm hungry, I'm thirsty. And we notice a corresponding thought, or we might notice an emotion. But these are all bidirectional relationships, meaning that nothing happens in the body without a corresponding thought or emotion. A thought or emotion will always have a body sensation, and many of us can't recognize that, especially when we've been going through treatment. So the stress response is normally not mediated through mindfulness if we are not mindfulness practitioners. And so what usually happens is that we have a habitual stress response through the autonomic nervous system. That can lead to maladaptive coping, it can lead to addictions, it can lead to obesity, it can lead to many different health outcomes. But when we're able to bring a mindfulness-mediated stress response into the picture, that allows us to downregulate our nervous system, reducing the cortisol, reducing inflammation responses, and allowing us to actually be present in the moment, to what our needs are as a whole person. So our thoughts, our emotions, and our body sensations working together. And when we have developed this space that I mentioned that allows for conscious choice between the stimulus and response, we have the ability to shift our perception. So if you look at the image on the left-hand side, how many of you see a vase? Yeah. How many see two faces? Right. So people in the room have different perceptions. And on the right-hand side, how many see a young woman? And how many see an old woman? Right, so half and half. So by allowing ourselves to see things in multiple different ways, it allows us to make choices. And when we have that agency, we have choice in our lives, we actually have the ability to have a different experience. So if we think about mindfulness, we can apply mindfulness to, as what Dr. Davey said he's studying is obesity, so the food that we ingest. We can notice the media that we take in, our social interactions. We can notice our physical activity. We can notice art, culture, and beauty and the impact that has on our overall well-being and our quality of life. So noticing that there's so much information available to us when we practice mindfulness around all of these inputs, basically, in our lives, we actually can be at a more restful state. So one of the things that we can do if we think we don't have time to practice mindfulness, even in 3 minutes, it's possible to change our nervous system. So if we find that our heart is beating, we're nervous, we're having a needle stick or an IV put in and it's painful, we can just take a moment to open up our senses. We can notice the sounds in the room. So in this room, we have the sound of my voice, the sound of the air conditioning, the people next to us. We can feel the chairs beneath our body supporting us. We can use all of our senses. Is there a smell in the room? Somebody's wearing a perfume. And from opening up our entire awareness, all of our senses, we can actually then narrow in our awareness to only our breath or to only sound if breath isn't available. And by doing that, each of these things for 1 minute each, our last minute, we open up our awareness again. So by taking 3 minutes, which is not a large amount of time, we can actually re-regulate our entire nervous system. And I briefly mentioned purpose, meaning, and legacy. So purpose matters in life. It matters because mortality is correlated with having purpose in life. So are cardiovascular events. There's been multiple studies on the impact of having purpose in life and how that correlates with better health outcomes, mental and physical. Meaning is another aspect that we like to focus on, because when a person has enhanced meaning in their lives, when their relationships are meaningful, their experiences have meaning and purpose, there's a level of resilience, focused on goals and outcomes, and the concept of leaving a legacy. This enhanced meaning in life actually corresponds with better health outcomes. And we can think about this quote on the slide that to live is to suffer, but we can also just acknowledge there's pain in life, anything from a needle stick or a stubbed toe to a cancer diagnosis. And we get to choose the type of relationship we want to have with that pain. We get to choose the depth, the level of our suffering once we create the space to recognize that we're in a place of suffering or pain. And when we lose meaning in our lives through experiences, role changes, uncertainties in relationships, then we have poor outcomes in life. So really focusing on what we're making out of our experiences can allow us to have a better health-related quality of life. And creating a legacy isn't just about doing legacy activities. It's about learning from the past, living in the present, and building for the future. And this enables us to live the kind of life that we want to live. It's a decision, right now in a conversation we had last night. Do we want to decide to live with mediocrity, or do we want to make decisions to live a life of excellence? So those choices influence and impact the choices that we make, the behaviors that we engage in a daily basis, and that will influence the quality of life we have during treatment and during survivorship. Connection is strongly correlated with mental and physical health outcomes. And frequently when we become a patient, when we're going through years of treatment or we have a recurrence, we can experience social disconnection because our peers, our family, our friends do not relate to our experiences, so we feel isolated, we feel alone. And there's actually a distinction between social disconnection, which is correlated with poor health outcomes physically, and loneliness, which is correlated with poor mental health outcomes. So social disconnection is not having a good group of deep connection socially with people. Now, those connections don't have to be huge. They don't have to be thousands of people that you know, but 1 or 2 or 3 really excellent connections with people give purpose and meaning to life. Loneliness is feeling isolated. So in this day and age of having thousands or hundreds of followers and connections on social media, people are lonely. They're disconnected. So finding a way to establish meaningful connections, whether that's through support groups, through colleagues, through friends, through other patients, finding a way to establish that ability to feel seen and heard can lead to excellent health outcomes. And social connection can be subjective, as I mentioned. That means that we might have 3 really great friends that we can call any time of day, rather than having 100 acquaintances. Connecting back with our bodies as we go through treatment, learning to trust bodies, learning to trust our physical sensations as signals, as symptoms. And sometimes when we have those symptoms, we might immediately catastrophize and believe that there's something going on in our bodies. This is a symptom. I've had a patient tell me that she feels PTSD when she has shortness of breath. So noticing the quality of our body sensations can really impact our well-being, our physical ability, and our quality of life. And I think that Dr. Tadani really did a beautiful job of discussing the connection with providers. So connection with our providers, our entire medical team, our staff, improves our health-related quality of life, decreases psychological distress, reduces stressors, and it really addresses life disruptors. So by letting your provider know, by partnering with your physician, with your oncologist, with your surgeons, your nursing team, the front office staff, and letting them know where you are and what is going on, they can connect you with resources like a social worker, a psychologist, a psychiatrist. Communicating those needs is really important when we're talking about whole person-centered care. And lastly, laughter. Now, laughter is highly underestimated as an indicator of health. And there's actually a type of laughter that is simulated laughter. It's called laughter yoga. And it actually has been shown to have health benefits, not only with quality of life, but also physically. And it's really something that has been studied around cancer patients as well. So if we think about this physiological impact of laughter, here's an exhaustive list: muscle relaxation, heart rate changes, respiratory changes, blood pressure, oxygen levels, endocrine stress markers, neurohormonal parameters, and pain threshold intolerance. So there's a very long list of physiological benefits to laughter, whether it's simulated laughter, such as a laughter yoga, or actual laughter. So incorporating laughter and humor can have, in addition to physiological benefits, can have psychological benefits as well. So improving mood, reducing stress, depression, anxiety, decreasing hostility, and improving self-efficacy and quality of life. So really thinking about incorporating many of these different aspects, or as many as appropriate for you at this time, can be a strong benefit to improving not only physiological but also psychological health. So the takeaway from survivorship, where we are right now, is really incorporating some aspect of mindfulness, thinking about legacy, purpose, and meaning. Being mindful of perceptions of situations, asking questions, connecting with other patients, and letting your providers know that there's some need that you have. You might be, into the phase of treatment where you're only checking in once a year or once every few months. But if intermittently there's a change in your psychology, a change in your mood, a change in your physiology, let your team know. Seek support from your team as collaborators, as partners with the team. Because if you don't let us know, we may not know. So that's really important for us to take away today, is communicate. Let us know where you are. Let us know what's going on so that we can work together collaboratively as a team. There's many local resources. There's resources internationally. Many cancer centers do have whole person programs or patient and family services. And there's resources like the cancer support communities and We Spark locally. Meditation centers, mindfulness apps can be very helpful to incorporate mindfulness, even if it's 10 minutes a day. The Calm app can be a gateway into learning mindfulness. And there's a particular mindfulness app or meditation called the Body Scan, which is available on the Insight Timer app, which is a way to get to know how body sensations can communicate thoughts and emotions. And you can always look on YouTube for laughter yoga classes or find a class near you. And I just wanted to thank Drs. Arash, Asher, and Jeffrey Wertheimer for their collaboration and inclusion. They have a program called the GRACE Program for Wellness and Survivorship through Cedars. And they also have a program for chemo brain, which can actually sometimes be a challenge, an exercise program for oncology patients. And if you have any questions, please don't hesitate to reach out through your physicians. Thank you.